Mind your head. Mind your head.
This is picture. Oh yeah, this folding table.
And in that box, there will be some medicines, consumables, and all.
Folding table.
Yeah, inside the medicines.
It's a tray.
Yeah, sure.
Dikhai di na aggressive.
Stool is there. See the patient.
And oxygen also is there.
Our diagrams.
Just open that board, that cupboard also.
In the name of God our Almighty, in the presence of friends from the Tata Group, from the Swasti, from the Entrepreneur Associates, and government officials from the Department of Health and Family Welfare, I flag off the mobile medical unit for the district of Zunheboto.
This launching of mobile unit, medical unit, is going to play a critical role, an important role in bringing or bridge the gap in the field of transport issues. Because in our area, in different places, we cannot pinpoint a particular issue, saying that this is the issue that is disturbing the health delivery system. But transport is also another one, and which we have to take care in to speed up the health delivery system. This is going to give us a privilege, and this is going to ensure the accessibility, health delivery accessibility, especially to vulnerable population like old age people as well as disabled people, those who don't get health care on time. And this is also going to give us, or going to give the privilege for early screening as well as vaccination, so that the problems and health issues are being diagnosed or detected on time.
MMU in Nagaland has been an important initiative to enhance primary healthcare access, particularly in the remote, hard-to-reach area and underserved areas, by providing essential healthcare services to the communities that are difficult to reach due to our geographical barriers and inadequate infrastructures. Here, I would like to highlight some of the key benefits of MMUs in Nagaland healthcare system. 1. Increased access to healthcare by reaching out to the remote villages and communities, providing essential healthcare services where traditional healthcare facilities are lacking or is too far away from the patient. This ultimately reduces the travel burden by bringing healthcare services closer to the people, thereby minimizing the need for patients to travel long distances, which can be a significant barrier to accessing healthcare. The comprehensive healthcare services focuses on preventive healthcare measures which help in early detection and management of healthcare issues, ultimately leading to better health outcomes. MMU provides timely medical attention or immediate care for minor emergencies such as injuries or acute illnesses, reducing the need for the patient to wait a long period before receiving treatment. It also acts as a rapid response unit and quickly mobilized to provide necessary medical interventions and support to the patients. MMUs often include health education as part of their services, raising awareness and about hygiene, nutrition, disease prevention, and healthy practices. MMUs support services to vulnerable populations and play a critical role in providing antenatal and postnatal care, vaccination of the children, and family planning services, thereby improving the maternal and child health indicators in underserved areas. MMU helps in lowering overall healthcare costs for communities by preventing severe health issues through early intervention and reducing the need for hospital visits. MMU therefore is a vital component of the healthcare delivery system in Nagaland, addressing barriers to access to the primary healthcare services, improving health outcomes, fostering community engagement in health, and has definitely contributed to the better health indicators in the area they serve. Hence, MMUs in Nagaland represent a vital strategy in addressing healthcare disparities in the remote region. Healthcare is a fundamental right, and yet, in many areas, access to essential medical services still remains a challenge. Therefore, MMU plays a very crucial role in bridging these gaps, bringing healthcare directly to the doorsteps of those who need it most.
We have been doing directly or indirectly to promote, healthy or health-related services in this state. So we are also ensuring girls of Nagaland get educated in health-related, academics curriculum, including MBBS and post-MBBS. So we are supporting that. We are also supporting people in enrollment in the government health schemes they are running for the government employee. We are also creating awareness across the state to see that they are aware of the welfare program of the government. We cannot be, means for social welfare scheme, or we cannot be, replaced by for social welfare scheme, but we will definitely be part of as means to communicate to the people. We have been working in northeastern state because we felt that this is the state where we need to create some kind of ecosystem which helps, improving the daily life of people of these states without impacting or affecting the fragile climatic or ecosystem of these beautiful states. So we are there to help and assist, or we'll be very happy if we generate enough purpose for our social responsibility. I'm sure we would be doing what you have suggested us to do in Nagaland. To end my small, speech, because I'm constrained by time, and though I have got a script, I am not going to refer it because it will take more time then. So we embedded what our forefathers or told us, the good value system, how you should pass on to the next generation. And JRD codes will remain our guiding principle forever. I was talking to somebody in New York. New York people told that group of companies in diversified business is going to be extinct because they don't have expertise. This Tata Sons prove it wrong. We are there from salt to satellite. We are there from agriculture to aviation. The best software company. And now as financial sector, we have been doing very well, much better than the rest of our peers in the market. It's not the time to promote the company, only the value system which we imbibe after doing a lot of research, which has become part of our vision and mission. So value system talks about integrity, empathy, customer first, people, performance and passion. With these 6 value system, we practice everything. Our objective and whatever action we take is guided by this value system, and that's how we are here. And we are really happy to be here on this, historical moment.
So I'll speak of 3 themes and 2 projects under each of these themes. Healthcare, as we are all aware. This is the launch of the MMU. The second is on social protection. My colleagues will talk about it in further detail, which is creating awareness and uptake of government, central and state government health insurance schemes like PM Jai, Ayushman Bharat, Jan Arogya Yojana, Pradhan Mantri Jeevan Jyoti Bima Yojana, the CM health insurance scheme. Under integrated rural development, so these projects, health projects, we are doing in partnership with Swasti and the Entrepreneurs Associates. Under integrated rural development, we have 2 projects. One is water conservation. This is in the Kifiri district, and livelihoods generation. It is to do with piggery enterprise supporting tribal women as well as honeybee rearing. This is being done in partnership with NEDA, Northeast Initiative Development Agency. They are an associate organization of Tata Trust. Under education, we have 2 interventions presently underway. First is a new project, sir, we have begun this year in Kohima, in Pradhan Mantri Shri Jawahar Navodaya Vidyalaya School in Kohima. It is 2 years of free quality coaching for entrance exams. That's NEET for medical and IIT JEE, which Madhukarji was mentioning. So standard 11, the first batch of 40 students from all states, northeastern states, with a focus on Nagaland. So that is one, and second is that is for preparation for entrance exam, and those who have cleared the entrance exam and got admissions in premier institutes in the country, such as AIMS, government medical colleges, IITs, NITs, government engineering colleges. There is a scholarships program focused on the Northeast, as well as a total about 14 states, but with the focus on North. That's presently underway. Speaking of this particular project today that we are inaugurating, it's indeed our honor and privilege to partner and collaborate with the esteemed state government of Nagaland. It's one could say a true spirit of public-private partnership. So the government is already doing very good work. So our contribution is augmenting and reinforcing the existing good efforts of the government, so that we are able to provide quality and effective primary health care to communities, especially the rural communities in the difficult to access hilly parts of the state. This, we believe, will go in a long way in our joint collective endeavor of serving communities, nation building and contributing to the global United Nations Sustainable Development Goals. I'd like to conclude by thanking leaders and teams of my NGO partners. I'd like to mention some names: the Entrepreneur Associate, Nekule Gracie, Swasti, Bhupati Rambabu, for bringing this project to life and continue to shoulder the responsibility for effective, impactful implementation on the ground, not only for months but years to come. I'm hopeful and confident that the esteemed Health Ministry, under your able leadership, sir, will continue to guide the department, and the department will continue to support the efforts of our NGO partners for seamless deployment and long-term sustainability of the project. I thank my senior colleagues, Shri Zunheboto and Shri Madhukar Sinha, for taking out time traveling all the way from Mumbai to be a part of this function. I put on record my sincere gratitude to the CSR Committee of Board of Tata General Insurance, especially my company chairman, Shri Saurabh Agarwal, my managing director and CEO, Shri Nilesh Garg, for their valuable guidance and unstinted support, without which this project wouldn't have been a reality.
I'll give you a little bit of information. Over the past 12-13 years, we have directly impacted 9.5 lakh people, or close to 1 million people, in the areas of social protection. There are more than 100,000 people who have been denied access to social protection services because they lack basic government identities like Aadhaar or driver's license, and we've been able to support them through the last 12-13 years. And through these social protection programs, we have unlocked about 2,000 crores worth of benefits for the community. Next. Since 2012, we have operated in more than 21 states, 3 union territories, including 41 aspiration districts. Currently, as can be seen in the graph, the yellow highlighted, we are operating in 9 states and 23 districts, including 9 aspiration districts. Through this journey, we have partnered with several state governments, and I am pleased to let you know that we have signed 6 MOUs with 6 state governments, with Nagaland government too. Thank you, sir, for giving us the opportunity. We operate at the block level. We operate with various ministries across various governments, agriculture, social welfare, etc., etc. And we partner with a whole host of national and international agencies, including Bill and Melinda Gates Foundation, USAID, Tata AAG, IndusInd, NASCOM Foundation, etc., etc. Right? So it is not possible for us to have done all this work without the support of the donors and the state government. Right? So as we launch this comprehensive mobile medical unit and social protection services in Nagaland today, I would like to acknowledge the unwavering support of the Ministry of Health and Family Welfare, Government of Nagaland, as well as Tata AAG General Insurance Company for bringing this project to life. It's indeed an honor for us to partner with the Government of Nagaland and with Tata AAG in delivering impact to the community. Our association with Tata AAG started off in September of 23, just a year ago, through the leadership of Mr. Devang Pandya. We worked in the states of Uttar Pradesh and Assam to deliver social protection services for about 95,000 people. We actually delivered a little more than 100,000 people, unlocked about 225 crores worth of benefits in the areas of social protection. That started off as a pilot, and with that successful demonstration of the pilot, we have now expanded to the states of Maharashtra and Nagaland for the first time, where we will be not only delivering social protection services, but also health services through the mobile medical unit. We are confident that given the common sense of purpose between the Tata AIG General Insurance Company, the Government of Nagaland, and Swasti, that there are going to be significantly additional opportunities for us to be able to amplify our impact and drive greater impact in the community.
Beginning with a small initiative in 2000 with an office in Kohima to promote entrepreneurial activities, we have now diversified and include initiatives focusing on holistic community development. We are now developing a focused approach even on agribusiness development. Currently, we work in Nagaland, Manipur, Arunachal Pradesh, Assam and Meghalaya, focusing on various aspects of community interventions to uplift the last mile and to engage in policies for their betterment. Beginning as a non-profit, we have instituted now a cooperative and other social enterprises along with an NBFC in order to increase our services to our communities. Currently, we provide training, skill enhancement, mentorship, financial services, and both market and financial linkages to communities we work with in the 5 states of the Northeast. Under our flagship program, known as the Trees for Wealth movement, we aspire to plant 3 billion trees of economic value by 2050, and we are proud to say that we have planted 30 lakh trees since its launch in November 2019. Under this program, we are also successfully conducting the 10K Run to Reforest, an annual event, and we hope to make it synonymous with Run for Reforestation. Our intervention in health began in 2017 when we started our Uplifting Women Street Vendors program and realized the dismal condition of women's health services. This led to us partnering with our health services and other various government departments in order to provide health services for the women. Therefore, this project that we have with Swasti and Tata AIG is the latest feather added to our works, and we are very proud of this achievement. We are therefore immensely grateful for the partnership that we have forged with Swasti and Tata AIG and with the Department of Health here in Nagaland, because we know that this can transform lives of the most unreached in the corners of Nagaland. We hope that this partnership will improve conditions of community members, and as our previous speakers have also said, we hope that this will bring health services to the aged and persons with disability who do not have access to these kind of services. And me, as a parent of a child with disabilities, I know that this is extremely important, and I hope that this will lead to greater scaling of our works even in other parts of the district and the state of Nagaland, and we hope that in the years to come or in the months to come, we would be happy to inaugurate such services in other parts of the state as well.
So we started this intervention in the month of July. So if you look at the 4 months performance, so I would like to thank my implementing partner team members as well as the government of Nagaland. We were able to link 9,000 plus community members with these prioritized schemes. So these are the top prioritized schemes. Almost 7,500 people were linked with Prime Minister Ayushman Bharat scheme. So again, my sincere thanks to implementing partner team as well as government of Nagaland. Next slide, please. So this is I think our director Vishwanath has covered the goal of the social protection project is so to reach out last mile access and link them successfully with the existing central government as well as the state government schemes. Yeah. So if you look at the MMU project objectives also, where we are launching today, so this is also mostly covered by our mission director madam. So to improve access to preventive primary healthcare services where community members are lacking. So the specific objectives is we promote community awareness campaigns, facilitate regular health screening camps, and also promote other healthy lifestyle among the community members with the treatment linkages and follow-up services. So I think the screening is going to start from next tomorrow or day after onwards. So before we launch, because our team members are already doing social protection intervention in the communities, we took that intervention as an opportunity to penetrate and promote this health awareness campaigns also in the community. So last 2 months, our team members were able to reach out more than 3,500 community members from almost 25 villages and 5 schools and generated awareness among the communities on healthy lifestyles. So these are some of the community awareness program events in the Zunheboto district, specifically focusing on Akuhaito block.
First of all, let us thank Almighty God for giving us this opportunity. In good health, we are here, and we have also heard a lot about the CSR projects being funded to the state of Nagaland by companies from Swasti as well as from the Tata groups. We are here this morning to launch a mobile medical unit for Zunheboto district. And if I may be given time to seek the presence of the CMO Zunheboto, MS Zunheboto, if they are here, could you kindly raise your hand? Okay, thank you. We are here to launch the MU, that is Mobile Medical Unit for Zunheboto District, supported by Tata AIG General Insurance Company Limited. We have heard a lot from the Tata Group about the yeoman service which they have rendered to the people of Nagaland, not only in the health sector, but in other sectors also. As envisaged and as being targeted by the Department of Health and Family Welfare. These initiatives represents a collective resolve to bridge the healthcare gap and ensure that quality medical services reaches every citizen, regardless of where they are and where they reside, especially those people living in remote, difficult, underserved and unreached areas. On many occasions, I have been mentioning about the healthcare services in the state, that it needs to be developed with the rest of the country. At this present generation, we all want ourselves to be embraced into civilization. When we embrace civilization, we become more comfortable. And when we become more comfortable, we become health conscious. We have concern on health issues. And today, Nagaland, as a state, we are focusing on development in the field of infrastructure, socio-economic, health, education, and various sectors. To embrace the education, to embrace the civilized society. And we are in that stage where we are getting ourselves to be more comfortable in lives. And once we are more comfortable in lives, we become more conscious to health. And because of that, the state government, led by a visionary leadership of Honorable Chief Minister, has launched the CMHIS facilities for the government servants, as well as implementing the Ayushman facilities, which is a central program reaching out to the farthest corners of the state. When the people have funds in their hands, when the people have money in the form of CMHIS and in the form of Ayushman, they have more concern on health. Therefore, this is a need of the hour where we all need to develop, where we all need to progress in the field of health services. Yes, in the urban areas, we can negotiate with the facilities. We can compromise with the facilities. But then in the farthest rural areas, this is where we need a lot of intervention from companies like the Tata Groups, the Swasti, the Entrepreneurs Associates to come to our rescue, to come to the help of the state. Friends, the mobile facility and the mobile medical unit is not just a vehicle. It is a beacon of hope for communities who have long waited for the essential healthcare services aimed to provide quality reproductive and child health services, including laboratory service, to plan and implement holistic healthcare strategy covering key areas of the primary healthcare component, promote village health, sanitations, and prevention of communicable and non-communicable diseases, and to promote health literacy through health education. Government of India, through National Health Mission, is providing human resource vehicle for transportation, drug and diagnostic and funds for mobility support. These mobile units will alleviate the need for long and arduous journeys to the nearest hospital, reducing delays in treatment and preventing the escalation of minor health issues into major medical concerns. For Nagaland, the medical mobile unit was started in December 2007 where 11 mobile medical units were launched in 11 districts and is fully functional in 11 districts, covering the newly upgraded districts. Recently, one district has been recognized. In meantime, the department is also proposing to central government for provisions of fully functional mobile medical units services for the new 6 districts. I am confident that this project will serve as a step towards in reducing disparities in healthcare access, serve our population with dignity, focusing on preventive healthcare as much as curative solutions. On behalf of the government of Nagaland and the communities we serve, I would like to extend my deepest gratitude to Tata AIG General Insurance Company Limited and the Swasti for your generous sponsorship of the mobile medical unit. I would also include the entrepreneurs associates. Your support has provided critical resources that enable us to reach people who lack access to health care. My best wishes to the CMO team of Zunheboto, and kindly ensure utmost care and maintenance for the mobile facility and mobile medical unit. Treat it as valuable asset to sustain its common conditioned service readiness. I think I had just had a meeting before I came to this program that from 19 onwards, the department is going for a tour to cover the districts. The key issues like the projects which has not been completed and also the manpower as well as the facilities available in the health centers will be taken into consideration. And in that, I think in the next round of our tour, Zunheboto will be included, where I would like to see that this mobile medical unit, the facility unit, should be there in a very good condition, serving the people of the Zunheboto district. With this launch program, let us reaffirm our commitment to the healthier, stronger, and more inclusive India. Together, we are taking a significant step towards an equitable healthcare system that truly leaves no one behind. So with this, as I've said, I have nothing much to share because much has been shared by the CSR providers who has been very kind to the state of Nagaland and to the people of Nagaland in providing so many schemes, so many programs, and non-profitable programs for the people of the Nagaland. So with this, I conclude my speech. Thank you. God bless.